Well, in this week's Cardiology News, we have an interesting look at secondary preventive medication doses, and also two evaluations, one of a hypertension control program in California, and finally a randomized trial looking at new approaches to Afib ablation. To begin with, we have an interesting look within two different registries at patients post-MI as to whether they received the appropriate post-MI medications, notably beta blockers, statins, and ACE or ARBs, but looking at whether they received the appropriate doses. And so it's been seen that in the trials that show the benefit, the doses are relatively high and towards the high end of the prescribing range, whereas in practice, often doses are lower. And so when they looked in these two registries, they found that nearly 90 to 95% of patients actually received the classes of drugs, but very remarkably, just 12, 26, and 32% receive the target doses, which they defined as 75% of the target dose used within the trials. And those are again for beta blockers, statins, and ACE or ARBs. And so this raises the notion that should we be monitoring not just the class of drugs, but also the doses, and be mindful in practice of pushing doses to get to those higher therapeutic ranges. We know that for statins, higher doses are better than lower doses in direct randomized trials. There's one also for ACE inhibitors, and so this looks like a very important new way of looking at the quality of care that we offer our patients. Next up, we have a very interesting look at a broad-based hypertension control program that the Kaiser Permanente health system put in place. And so they looked over a range from 2001 to 2009, where they put in place a multifaceted, broad-based control program where they developed stepped guidelines of what medications to use, used a registry, reported on performance metrics, and also had follow-up phone calls and contacts from medical assistants in addition to the doctor's visits. And towards the end of the program, they pushed the polypill approach of combination therapies as a way to improve adherence. And they found that they were able to boost dramatically the compliance and control of blood pressure, where meeting the HEDIS criteria went from 43% up to 80.4% by the end of this program. Whereas nationally, the trend went from 55 to 64, and within California, it was 64 to 69%. And so very encouraging that a relatively straightforward but broad-based program can improve blood pressure control. And finally, a randomized trial looking at a novel approach to Afib ablation. A group had done pilot data, and this is published in JACC, now did a randomized trial of about 170 patients, 80 per group or so. I guess that's 240 or so patients, where they did conventional pulmonary vein isolation and then did circumferential antral ablation with the ganglionated plexi as a second approach, and then did the combination. And they found that either procedure worked about well, but combining the two of pulmonary vein isolation and going after the ganglionated plexi improved freedom from AFib or a flutter up from 56 for 48% for individual procedures up to 74%, a significant difference. And as such, they note that including this dual approach to ablation may be a better way of getting control of AFib. So for this week's Cardiosource News, I'm Chris Cannon.